Hi guys, my name is Diana Wilcox and we are going to talk about the social determinants of mental health. So, according to a definition provided by the World Health Organization, one should understand social determinants of health as the condition in which people are born, grow, live, work, and age. These circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels. Public policies and social norms influence distribution of opportunity, which affects access to food, housing, education, distribution of wealth, and social acceptance, which influences the options that one has in life, the choices, the amount of stress, and the high-risk behaviors. In the end, by the mechanism of gene by environment interaction, the results are poor mental health, disease, and morbidity. Recently, I asked a patient, "Where do you currently live?" And he replied, "Sky is my roof." Unfortunately, my understanding of sky is different than his understanding of open sky. So I decided to address homelessness as a social determinant of mental health. The lowest on Maslow's pyramid of needs are the physiological needs of air, water, food, shelter, sleep, clothing, and reproduction. Unfortunately, mental health disease affects people's ability to carry out essential aspects of daily life, such as self-care or being able to take care of a house. Mental illnesses also disrupt individuals' ability to form and maintain constant relationships, which often result in driving away caregivers, family members, and friends who may be the support system that can help individuals stay away from streets. The inability to accept or ask for help and the stress of living with a mental disorder puts individuals with mental illness at a higher risk of becoming homeless. We see homeless people every day, and unfortunately, they become a constant of our lives. We see them in our stores, at intersection, downtown, parked on the roadside, to the point that they become invisible. And I think that this is very dangerous. When we start seeing the misery of another human being, when we become untouched by their pain and suffering, it means that we lost our humanity. It feels like we are living in two parallel worlds. But let's look at homelessness and numbers. So, according to the National Alliance to End Homelessness website, there are 580,466 individuals experiencing homelessness in the United States in January 2020, and 30% of them were people living in families with children. The national overall rate of homelessness is 18 out of every 10,000 individuals. As data shows, males are more likely to experience homelessness than females. There are 22 homeless males for every 10,000 males, while there are 13 homeless women to every 10,000 female in general population. Race is another significant predictor of homelessness. Numerically, white people are the largest racial group with homelessness, followed by Black, Hispanic, multiracial, Native American, Pacific Islander, and Asian. But when we look at homelessness by race, the native Hawaiians and other Pacific Islanders have the highest rates of homelessness with 109 out of every 10,000 people, followed by Black or African Americans with 52 out of every 10,000 people, and Native Americans with 45 out of every 10,000 people. Now, let's look what is happening in Washington state. According to the same source, there were 22,923 homeless individuals in Washington in 2020. Out of these, 5,943 are chronically homeless individuals, 1,607 are veterans, 16,198 are individuals, and 6,725 are people in families. Additionally, there are 1,777 unaccompanied youth, and 10,814 are unsheltered individuals, which means that they live under the blue sky. A lot of big words and a lot of big numbers. So I live in Olympia, Washington. Here, homelessness seemed to overwhelm the town. A 2020 homeless report published by the Thurston County Public Health and Social Services Office of Housing and Homeless Prevention showed that there are 955 homeless individuals living only in Olympia alone. 541 of them are unsheltered, while 295 are sheltered and 159 are transitional. Homelessness is not a choice. It is determined by social factors such as family adversity, psychological trauma, poverty, and social disconnection. In Olympia, the self-reported causes of homelessness are loss of housing, loss of jobs, family rejection, substance use disorders, physical disability, lack of training, mental health, domestic violence, jail and juvenile discharge, and abuse and neglect. When these factors are looked from a holistic point of view, one can see that all these factors work together into determining a person's life, access to health care, housing, education, and life opportunities. In Thurston County and Olympia, the age distribution for homeless folks is concentrated in the 45 to 65 age group and individuals under 18. In the above graphic, we can see the race distribution of homelessness population in Thurston County and Olympia. So, how is mental health affecting homelessness? According to data published by the U.S. Department of Housing and Urban Development, 564,708 people were homeless on a given night in the United States, and 25 of these people were seriously mentally ill, while 45% had any mental illness. Additionally, according to a systematic review of literature that looked into the schizophrenia rates in homeless population, found that schizophrenia can be as high as 16% in homeless individuals, with higher rates in younger persons, women, and chronically homeless. Additionally, a 2021 updated systematic review and meta-regression analysis found that besides schizophrenia, major depressive disorder and bipolar I disorder have a high prevalence in homeless population too. As psychiatric comorbidities in homeless population, a 205 study identified besides depression as comorbidities anxiety disorder, PTSD, alcohol use disorder, cocaine, and heroin. Being homelessness is not an individual problem. It is a community and societal problem. It affects all of us and it touches all aspects of an individual life. All of us need to help and change the face of our society by proposing and supporting change and accepting to pay the price. So what can we do to reduce homelessness? Such a big question with a challenging answer. Homelessness is multifactorial and it affects, as we see in all races, all ages, all sexes. The approach that is implemented in Olympia is the so-called Housing First. Olympia has the Housing Authority of Thurston County that develops subsidized project-based 1 to 5 bedroom homes, duplexes, and apartments for homeless individuals. It almost feels like the legislator wants to take the homelessness out of the streets, so nobody sees them anymore, but without offering a sustainable and viable long-term solution. From what I see, the problem is not a lack of housing. The problem is that the legislator fails to look at the solution in a holistic way. Individuals need much more than houses. They need support, they need acceptance, education, and access to health care. So, one intervention that I support is creating more free clinics for homeless population. We used to have 2 free clinics in town. One was a community free clinic, while the other one was a free clinic supported by Providence. Since COVID, the Providence free clinic closed, and the community free clinic is not covering the needs of the homeless population. Every day there is an enormous line in front of the community free clinic. The Healthcare Authority should finance statewide mobile free clinics that can travel and meet the consumers where they are. A second intervention that I propose is to develop centers that can offer information and educate the homeless population about the resources that are available to them. For example, I take my children to the local library so they can find books to read. During my visits, I noticed that in the Olympia Timberland Library, there are homeless folks that come to use the facilities for restroom, but also for internet services. If we would use the libraries or create similar offices that would offer information about available resources and educate them, I think that would help some of the individuals to find the help that they need. And the third intervention that I suggest is that the state finances free education for homeless population. As we've seen in a previous slide, lack of education is one reason of homelessness. So I work at South Puget Sound Community College, and I hear in every meeting that our enrollment rates are down, except of course for nursing. I think that if the state would support the cost of education for a homeless population, that would be an immense opportunity for some of them to attend a trade or technical college and earn a degree that would allow them to get a job and have income. Recently, I read in the Olympian or heard on the local news that the Department of Commerce saves now $2 million yearly by allowing its employees to work from home and hence using less office space. If some of of those money would be allocated to education for homeless people, that would allow in long term for more money that come from the created jobs that can be taxed. So what can I do to help reduce the mental health disparities? As I believe that we can improve the mental health of the adult by addressing the mental health of the child, I want to specialize in child and adolescent mental health. Additionally, I want to offer 10% of my time to the local community clinic. And finally, a big dream of mine is that I want to initiate and support a legislative proposal that will allow parents to receive up to 2 years of paid parental leave if they worked for at least 18 months previous to the birth of their child. The amount of money would be 80% of the parent's income, and it would be capped at the average monthly income. I hope that if some of you listen to my post, maybe you will want to support this initiative when you'll hear about it. Because according to an article published in Harvard Review of Psychiatry by von Neal et al., paid maternity leave is associated with beneficial mental health effects for the mothers and children, including decrease in postpartum depression. The article also pointed out that the paid maternity leave helped decrease domestic violence, infant mortality, and mother and infant rehospitalizations. So, in conclusion, we need to help each other. As mental health providers, we need to take a more active role in our communities and on legislative level. Thank you for your attention, and here are my references. And have a wonderful day, all of you. Bye.